He's a professor of cardiology. First, when there's a block in the coronary artery, the balloon port open பண்ணுவாங்க. So the rectal wall கொஞ்சம் பெருசா ஆயிடும். So but blood vessels rectal wall like elastic rubber band, it will just close sometimes. அது prevent பண்ணதுக்கு தான் we used to do put a stent. Stent means a spring, ஒரு பேனோட ball பேனோட spring மாதிரி. அந்த spring அது போட்டாச்சுன்னா vessel collapse ஆகாது. அதுக்கு ஒரு stent. But the stent க்கு ரொம்ப ப்ராப்ளம் இருக்கு. Stent இருந்தாச்சுன்னா there is a 5 to 10% chance that அந்த stent குள்ளால clot வந்துடும். Stent later may திருப்பி block ஆயிடும். இதென்ன stent வந்து போகாம எப்படி இந்த rectal repair பண்ண முடியும்? That is the new innovation of drug coated balloon or medicated balloons. அதாவது rectal full open பண்ணி வச்சு அதுக்கு அப்புறம் இந்த balloon போட்டு open பண்ணிடும். The balloon the balloon is coated with a drug, a healing drug, and the drug will get smeared or get painted to the vessel wall. So that திருப்பி அது block ஆகாது அந்த thrombosis பண்ணாது. Secondly, if you put a stent, the spring போட்டாச்சுன்னா blood vessel will dilate and contract depending upon the physiological need. Sometimes the contract sometimes like the rubber band. If you put a stent and the function போயிடும், it will be just like a PVC pipe. If you do a drug coated balloon, அது ஆகாது அந்த பிரச்சனை இல்லை. It will respond to our physiological needs. Secondly, stent போட்டாச்சுன்னா you have to take blood thinning medicine 1 year or sometimes lifelong. So blood thinning medicine எடுத்தோம்னா சில patient will develop bleeding and some surgery you have to stop it for 5 days. Elderly people bleeding for ulcer, lot of things can happen. இதுக்கு short course of antiplatelet blood thinning medicine needed. 3 months, 6 months is more than enough. See that is the advantage. ஒரு foreign body இருக்காது, அந்த stent related issues இருக்காது, plus the blood thinning medicine dose கம்மி பண்ணும். But open பண்ணிட்டு அந்த drug எல்லாம் உள்ளால போச்சுன்னா balloon will deflate the balloon and take it out.
Stent போட்ட பிறகு after some time
balloon first ஒரு balloon போட்டு full open பண்ணுவாங்க. இந்த balloon இல்ல, full open பண்ணி விட்டதுக்கு அப்புறம் இந்த balloon. This balloon is not for opening, this balloon is to deliver the drug to the vessel wall. அதாவது எங்க இந்த மெடிசின் டெலிவர் பண்ணணும் அதோட ஒரு டூல் தான் இந்த balloon.
எல்லா ஆபரேஷன்ஸ்லயும்
பண்ணலாம், but only select it is not an alternative to stent பண்ணித்தான் நான் சில டிசீஸ்ல சில சைட்ஸ்ல. பட் சம்டைம்ஸ் ஃபார் எக்ஸாம்பிள் somebody had a main vessel ஒரு block plus ஒரு branchல இருக்குன்னு வெச்சுக்கோங்க. Main vessel we put a stent and branchல we put a drug coated balloon. Secondly, sometimes the vessel, you know, the rectal size from origin to the end is not the same. It is tapering like this. So in tapering proximal part we put the stent, distal we put a drug coated balloon. Thirdly, in India there is a very high incidence of diabetes. Diabetic people who have diffuse disease, multiple disease, small vessels எல்லாம் அப்படி வர பேசன் the small stent போட்டாச்சுன்னா திருப்பி block ஆகிறதுக்கு சான்ஸ் ஜாஸ்தி. Some patient the drug coated balloons are very useful. Medicine, once you open the artery, there is some injury to the vessel wall, and the injury heal பண்ணதுக்கு தான் the healing drug கொடுக்குது. Once it is healed, the drug will disappear after 60 to 90 days.
The Dexod power
effect, the Dexod effect is only for 60 to 90 days. அதுக்கப்புறம் Dexod effect இருக்காது. பட் அது போதும், அதுக்குள்ளால arteries remodel. Just like இந்த கையில ஒரு இன்ஜுரி வந்து அது ஹீல் ஆகற மாதிரி. அதுக்கப்புறம் அந்த ட்ரெஸ் ஒன்றும் பண்ண தேவையில்லை. லைக் தட்.
சோ திருப்பி அந்த இடத்துல பிளாக் ஆகாது.
திருப்பி ஆகாது.
But doctor, do we know
restenotic rate we are study published and it depends on the lesion, but I would say between 5 and 10%.
almost equal to a stent?
Almost equal to a stent. The only difference is that you do not have a foreign body and the re-narrowing is easier to be treated because when you have a metal and the re-narrowing is more complex to treat in-stent restenosis compared to DCB restenosis.
What is the chance?
Usually when you do balloon inside an old stent, the chance of having a problem is very small.
Okay.
So the only chance is that the result may not be so good because you have sometimes so much proliferation, so much scarring that you may even have to place a second stent, and sometimes the third time a third stent. So that's the reason why the restenosis in a stent may not be so benign and so easy to be treated. I have some unique patients that have even 4 or 5 stents, one on top of each other, because of repeated re-narrowing. The second question about the cost.
Probably Indian.
In India, the cost of the stent and balloon is the same. See, still this is a novel technique, this is an uncharted sea. There's a lot of research and studies going on. And Professor Colombo is also doing a lot of studies on drug-coated stents with multi-center randomized controlled trials. So we have to wait and watch for the result. The stent has been there for the past 30 years. But this also we have to see the results. But it is very, very promising, especially in Indian context,
No, but
where the vessels are
drug-eluting
smaller.
stents are relatively new compared to the bare metal stents. So isn't it easy?
Drug-coated stents are not new, it is there for the past 20 years.
Yeah.
Drug-coated stents are there for the past 20 years.
And this is for?
This is drug-coated balloons.
And this is
because
for how many years, doctor?
it is
4 or 5
drug-coated balloon,
years. 4 or 5
5
years.
5 years.
Yeah.
But they became more common in the last 2 years.
We need long-term data, that's only the time will tell. But there's a lot of studies going on in different kinds of patients, diabetic patients, bifurcation lesions, and calcific lesions, lot of things,
But,
small vessels, everything.
The bare drug-eluting stent to drug-coated balloons, the advantage will come if it comes after 3 or 4 years. So, because the immediate results are going to be good for both. But the fact that you do not have a foreign body will be seen after 2 or 3 years. So that's the reason why these studies are complex, because every time you do a study you want a result immediately. You have to be patient and keep on following the patient for 3 or 4 years. So the study becomes complex, expensive, and not easy, because you cannot lose follow-up from patients, otherwise the results become not validated.
One more thing, if you put, there is 5 to 10% chance of stent clotting and then restenosis come. And then if you put it, and then the vessel will lose its normal physiological contraction line. Everything can be alleviated, can be eliminated if you put a drug-coated balloon.
But there are
Secondly, if you put a drug-coated balloon, the restenosis, because after a drug-coated balloon application and a restenosis after a stent application, it is different. It is very easy to treat a restenosis with the drug-coated balloon, but the restenosis with the stent is not very easy.
So when you see high risk